Aloha! Thank you for joining me today. My name is Dr. Taketa-Wong, and I'm a naturopathic physician and acupuncturist. So for those of you who aren't familiar with naturopathic physicians, like medical doctors, we do attend a 4-year medical school. We are trained as primary care physicians, and as such, I can order lab tests, write prescriptions, and do school physicals just like other doctors. However, a big difference is that naturopathic doctors are trained in the power of nutrition to build health from the inside. I use personalized food recommendations, vitamins, herbs, and other types of natural medicines to address the underlying causes of disease and treat the whole person. I also have a master's degree in Oriental medicine, which allows me to include Chinese medicine and acupuncture in my treatment protocols. So before I begin, I just wanted to let you know that if you have any health concerns you want to talk with me about, that we do offer a no-charge phone consultation called the Personal Health Strategy Session. The 15-minute strategy session is where we can talk about your condition and come up with a plan to see how I can help you the most. Arranging a consultation is very easy. Just call our office at 808-425-2987 and let our staff know that you're interested in a no-charge phone consultation. Okay, let's get started, and please feel free to use the comment section to ask questions as the talk progresses. So today I'm going to talk with you about autoimmune diseases. And speaking of which, I just wanted to mention that there's a local nonprofit organization that I serve on the medical advisory board called the Sjogren's and Lupus Foundation of Hawaii. They do great work in supporting people with autoimmune diseases, and they're hosting a conference on Saturday, May 4th. So we'll be putting up their flyer on our Facebook page, and I just encourage you to check it out. So they, again, it's for Sjogren's and lupus, and can be helpful for other autoimmune diseases as well. But basically, I think the conference is really going to be a great, a lot of really good information that'll be shared, and particularly if you're living with Sjogren's and lupus, really helpful. So just to start out with in talking about autoimmune disease. So autoimmune disease is where our body's immune system is actually attacking organs or other parts of our own body. So normally our immune system is supposed to attack things like bacteria or viruses or yeast, things that can make us sick, basically. But in the case of autoimmune disease, what's happening is that our immune system is attacking our own body. And so there are a number of different autoimmune diseases. I'm just going to mention some of them. Some of the more commonly known ones include things like lupus, Sjogren's, rheumatoid arthritis, Hashimoto's disease, Graves' disease, ulcerative colitis, Crohn's disease. But there are actually many more autoimmune diseases in that there are over 80 identified autoimmune diseases. And each one affects different parts of the body and can cause different types of symptoms. So depending on what part of the body the immune system is attacking. Now, if someone has a condition that's really severe, or if their immune system is attacking certain organs, then doctors will typically use really strong drugs to suppress the immune system. But unfortunately, most of the treatments typically can't suppress only certain parts of the immune system. So what happens is that the entire immune system typically gets suppressed. And so what happens when that occurs is that people who are on those really strong drugs that suppress the immune system tend to get more prone to infections or get sick because, like I mentioned, normally our immune system is supposed to attack viruses or bacteria, things that can make us sick. But if you suppress the entire immune system, you can stop the immune system from attacking your own body, but you're also going to have less of a response for your immune system to attack bacteria or viruses or things that can make you sick. And as a result, people who are on these really strong drugs tend to get sick more often. And some of the drugs that are used are also used as chemotherapy drugs. So there are often a lot of side effects that come along with that. And some of the drugs that are used to suppress the immune system can also cause problems with the body's organs themselves. So sometimes there's concerns about it affecting the kidney or liver or other kinds of organs in the body as a result of the drugs themselves. So if people are having really severe symptoms, they often need to take conventional pharmaceutical medications. And I'm certainly not opposed to that. With a number of autoimmune patients that I work with, they have a rheumatologist, and that's really important because the rheumatologist is the expert in terms of looking at what types of drugs they will need to control those symptoms and to make sure, in some cases, some autoimmune diseases can be so severe that it may actually be fatal if it gets out of hand. So that's, of course, really important. But in working with what I do in terms of working with patients is that I'm often working on trying to figure out what are things that we can do to, over time, help to balance or regulate the immune system, to try to help keep the immune system from attacking your own body so that we can, over time, start to decrease that. And one of the things one thing to note is that natural medicine definitely takes time, and it sometimes can take a long time, especially if the condition is more advanced. But it can work, and I have seen patients that have eventually been able to get into remission from different types of autoimmune diseases, who have been able to lower the dosage of their medications, or in some cases be able to get off of them completely. So that is possible. I have seen it, but it does take time, though. And in many cases with autoimmune disease, I work with patients to help them change their diets because sometimes certain foods can cause problems. And often I find that with many patients with autoimmune disease, that diets really make a big difference in terms of helping to calm the immune system down. And I also look to see if there are nutrient deficiencies as well. And so changing the diet can help to address those kinds of things. There are also certain things like vitamins, like vitamin D is very important for helping to keep the immune system balanced. Another thing that's important are things like probiotics. So some of the good bacteria. That will depend to a certain extent on what kinds of drugs the patient is taking. So you always want to have someone who's trained in terms of working with, especially if you're on pharmaceutical medications right now, because not every supplement is going to be okay with the different drugs. So it's important to have someone who's well trained in terms of the interactions. And that's one thing that I work a lot with, because I'm trained in both the pharmaceutical side as well as natural medicines and supplements. So I'm aware of the different interactions that can happen. So, but things like vitamin D and probiotics are important for helping to keep the immune system balanced. And what I mean by balanced is that if you think of the immune system like a seesaw, you don't want the immune system to get too weak, because if the immune system gets too weak, that means that the person gets sick all the time. But on the other hand, you don't want the immune system to be in this overactive mode where it's out of control and it's attacking the wrong things, like it's attacking your own body. So what we want is we want the immune system to be balanced, where it's not too weak, where you're getting sick all the time, and it's not too overactive where it's attacking the wrong things. We want it to be balanced. And there are a number of things in natural medicine that we can do over time to help to balance the immune system. I also will screen typically for heavy metals, so that includes things like lead and mercury and arsenic. And these are toxins that can set off or trigger the immune system in some cases. So, and those are things that, we'll try to decrease in the body, to get out, so that the toxins aren't continuously triggering the person's immune system. So I also look for other kinds of toxins, because there are other types of things like herbicides or pesticides, which can have heavy metals, but there are other kinds of things that can be problematic too. So there's toxins like BPA or bisphenol A that is known to cause problems with different parts of the body. And there are a number of other toxins that can be problematic. So, but my personal theory, this hasn't been conclusively proven in research studies, but I think that part of the issue in many autoimmune diseases is an increasing load of toxins in our body. And the incidence of autoimmune disease is increasing, especially in westernized countries. But often if you look at countries, developing countries where there, people are living a very traditional type of lifestyle, hunter-gatherer societies that are, living in a way that their ancestors lived hundreds of years ago, that oftentimes there are, if you look at the incidence of autoimmune disease, in these types of societies, essentially autoimmune disease is almost non-existent in many of these societies. So that leads us to look at what are some of the factors that lead to a higher incidence of autoimmune disease in developed countries. And I think that part of that puzzle is the increasing load of toxins that we have. So there are, of course, herbicides and pesticides that are used on most foods that are grown and that are consumed in many developed countries, and other kinds of toxins. And then also processed food, junk food, sugar. We really saw the incidence of autoimmune disease really start to spike and increase when industrialized refined sugar was first introduced into when it was first created. And there is definitely research that finds that the gut bacteria and gastrointestinal conditions can definitely be a big part of autoimmune diseases. So there's a question here. That someone asked, do you have a recommendation for a good probiotic? So in terms of probiotics, it really varies quite a bit according to the person. And there are many different strains and species of probiotics, and they do different things in the body. So what we're looking for, the results that we want to see and the symptoms that a person has will really determine what type of probiotics I'll recommend. So in terms of brands, I can kind of talk in terms of general brands that I like. So Claire is generally a good brand, Klaire, and I don't have any financial connections to these companies. But Claire, they have good probiotics. There's also a number of other good probiotics that patients with autoimmune diseases will use. So Custom Probiotics makes some good ones. And there's also Gut Pro is a good probiotic. But it really depends a lot in terms of the specific product on what we're looking for in terms of the therapeutic effect for a person. There was also a question, how do you feel about prebiotics? And prebiotics are good types of fibers or sugars that are food for the probiotics, or the good bacteria. Prebiotics, they are on the label oftentimes as things like inulin or fructooligosaccharides, or FOS. And prebiotics, they can be helpful. I will say in some patients, especially patients with digestive issues, sometimes the prebiotics can be helpful and sometimes they can actually be problematic. So there are some people who have difficulty breaking down prebiotics, and as a result, they get more gas and bloating with prebiotics. So it depends. You can certainly get prebiotics in a number of foods, and I certainly recommend prebiotics in the form of foods. That's kind of beyond the scope of this discussion, but people can certainly Google like prebiotics in foods, because there are a number of foods that are really good sources of prebiotics. And some other things. While we're on the subject of probiotics and prebiotics, there's research finding that actually the good bacteria in our gut, those good bacteria that are probiotics basically, that they will actually talk to our immune system cells. They actually exchange chemical messages, and that those good bacteria are actually really important to help to regulate or balance our immune system. So if someone, for example, has had repeated courses of antibiotics, which is often the case with people who have autoimmune diseases where they get sick a lot, and then they're sick, so they have to go on antibiotics, and if those good gut bacteria are not replenished, then what can happen is that they start to get more and more problems, and immune system problems can develop later on as a result of the imbalances that are in the gut. So there is a comment asking about fermented foods. So fermented foods are usually well tolerated by most people. There are some people, if their immune system is really suppressed, if they're on really high doses of certain immune suppressing drugs, then they may have to use caution with probiotics or with fermented foods, because in some cases, if someone's immune system is really, really weak, then those good gut bacteria, taking them in the form of a supplement or in fermented foods, can sometimes actually cause an infection if someone's immune system is really, really weak. So I always try to do tests in terms of looking at their immune system function and trying to gauge those kinds of things. But in general, fermented foods are a natural source of probiotics and generally are good for most patients with autoimmune diseases. So there was also a comment about gadolinium, which is another toxin. And Donna commented, can vitamin D insufficiency or deficiency be an important role? Yes, absolutely. Because vitamin D, as I mentioned earlier, it's one of the vitamins that's really important to balance the immune system, to keep it in balance. So if someone's vitamin D is too low, then you can have problems on both ends of the scale, where you have your immune system that is too weak, where someone tends to get sick a lot, and then it can also cause problems where the immune system can tend to attack other organs in the body. It can attack your own body. So vitamin D is really important. I usually will check serum levels of vitamin D, and I like to see the vitamin D, the 25-hydroxy form of vitamin D3. I like to see that ideally about 50 to 80 nanograms per mil. So most places will say 30 is fine, but optimal levels are really about 50 to 80. There's also a question, can the newer heavy metal toxicity affect the vitamin D? And then explain why I'm not absorbing them orally. So there are a number of things that can explain why vitamin D may not be absorbed. I do have some patients that have low levels of vitamin D, and then they're taking super high levels of vitamin D, and then their vitamin D levels in their blood never go up. So there's a few things that could be explained by there are certain genetic mutations that can cause problems with absorbing vitamin D. And there can also be sometimes chronic viral infections that can cause problems with the body's ability to process and use the vitamin D. So those are a couple of things that can explain that. There are also a couple of other things that I look for in terms of the immune system. So there's something called methylation, and methylation affects a lot of different things in the body. It affects the immune system, and it also affects our detox pathways, specifically our liver detox. So that's also important for keeping the immune system balanced. So usually I will test the methylation pathways, and if it's out of the normal range, I'll use specific types of vitamins and nutrients to get it back in balance, to help to balance the immune system. Hormonal imbalances, even if someone has things like lupus or Sjogren's, which most conventional doctors don't usually think about hormones with those, but hormone imbalances can also cause the immune system to be out of balance, because the hormones also communicate with the immune system. And so another thing that we'll do is try to balance hormones, and that's another thing that can help to keep the immune system in balance. So we'll be wrapping up shortly, but I just wanted to remind you that we do offer a no-charge phone consultation if you want to talk with me personally about any health concerns that you have. So again, arranging a consultation is very easy. Just call our office at 808-425-2987. and let our staff know that you're interested in a no-charge phone consultation. And again, I just want to remind you about the Sjogren's and Lupus Foundation of Hawaii. They, again, do excellent work in supporting people with autoimmune diseases, and they're having a conference coming up on Saturday, May 4th. So again, check out our Facebook page. We'll be putting up a flyer about that with links there with more information about that. So I want to get to specifically talking, I mean, of course, we can't cover all the different autoimmune diseases today, but two that I wanted to focus on that I see quite a bit in my practice are two autoimmune diseases that affect the thyroid specifically. So, and those are Hashimoto's and Graves' disease. And my treatment typically includes very thorough lab testing, using individualized nutrients and vitamins tailored to the person's needs. Again, those are often based on lab tests. I also use Chinese and Western herbs, improvements in food choices, and hormone therapy if needed. So Hashimoto's thyroiditis, or Hashimoto's disease, is a condition that is very, very frequently underdiagnosed in conventional medicine. And in Hashimoto's thyroiditis, most often the thyroid is low functioning. However, it can occur where the thyroid is too high functioning. So sometimes Hashimoto's patients can tip back and forth between low thyroid function and too high thyroid function, but most of the time they usually tend to have low thyroid function. But the reason that Hashimoto's is often underdiagnosed in conventional medicine is that, you know, most conventional doctors usually only do 1 or 2 tests to assess for thyroid function. And when there's low thyroid function, many doctors do not test for thyroid antibodies. So antibodies are what the immune system uses to attack the thyroid, and that indicates an autoimmune condition. So I've seen many patients that have come to me with, they're diagnosed with hypothyroidism or low thyroid. And they may be on something like Synthroid, levothyroxine, which is a thyroid hormone that's used to help increase the thyroid hormone levels to normal. But most of the times, many of these patients are not checked for autoimmune disease. They're not checked for thyroid antibodies. And most doctors will say, oh, you know, if your TSH, that one thyroid lab, if that's normal, there's no need to do other labs. And I tend to disagree with that. My experience, I've seen many patients with a normal TSH that actually have very high levels of thyroid antibodies. And for me, it does make a difference if the patient has an autoimmune condition, because that adds a whole nother level of treatments and things that we do. Because like I said, someone can have low thyroid function, but if they have an autoimmune disease, then I will look at all of these other things to try to help balance the immune system. So that's one of the things that I do is I'll check. And so I've diagnosed a number of Hashimoto's patients where they came in, they thought they only had hypothyroid or low thyroid function. And we did some tests and found out, oh, you have an autoimmune disease, like your immune system is actually attacking your thyroid. And that's why you have thyroid problems. So what's the answer? We need to try to balance the immune system again so that the immune system is not attacking your own body so much. So some of the things that we do in terms of treating Hashimoto's is that both Hashimoto's and Graves, but we'll often check the adrenal gland. So the adrenal gland is a little gland that sits right on top of the kidney, and it also talks to your thyroid gland. So that's something that's really important that most conventional doctors don't do. And the thyroid and the adrenal gland, they make these different hormones and they're linked up together. And so if there are imbalances in one gland or the other, then that can affect both of them. So if there's low thyroid function, very, very often there tends to be low adrenal function as well. And if you're just trying to treat only the thyroid and you're not addressing adrenal problems, then it's going to be very hard to get the thyroid better because we also need to treat the adrenal gland as well. And there are herbs and a number of other things that can be very helpful for helping to treat the adrenal gland. So that's something that I will often do. Now, in Graves' disease is an autoimmune thyroid problem where what happens is that we're often, in Graves' disease, there's hyperthyroid, where the thyroid function is too high. And that can be due to basically what's happening is that the thyroid is secreting higher than normal amounts of thyroid hormone, and then that can cause the opposite types of symptoms as low thyroid function. But with Graves' disease, often it can be life-threatening if it's not controlled. So often it is treated with conventional drugs when it's in a really acute phase, when things are really bad. But what we will often do is same kind of things. I'm looking to see what are the things that are out of balance that we can use to bring the immune system back into balance. So with both Hashimoto's and Graves' disease, we're really looking at all of these different kinds of things. Again, vitamin D, heavy metals, looking at the adrenal function, looking at other types of minerals and nutrients. So zinc is another important mineral that's really important for immune system function. And if zinc is too low, then that can also be something that can contribute to the immune system being out of balance like this. So we'll look at all of those things. And with Graves' patients, we want to see that their numbers are getting better and that they're not having, of course, Graves' symptoms, and that their attacks, if they do get attacks, are getting less severe and fewer and farther between. So it's really looking, again, at that whole picture. And other things that we'll do when we're looking at all of these things, so I often will use homeopathic medicines to help to regulate and to balance both the thyroid and the adrenal glands and other kinds of things. And just going to some of the comments. So one of the comments, someone was commenting about their vitamin D and saying, I take 50,000 IU of vitamin D3 weekly and her vitamin D is still low. And so if that's the case, then I would definitely test for both 125 hydroxy as well as 25 hydroxy vitamin D. And I think you pronounce your name Kirsty, but I would encourage you to schedule a free phone consult so we can talk more about that, because like I said, there could be certain genetic mutations that can cause your body to have problems with absorbing the vitamin D. There can sometimes also be issues, like I said, with chronic viral infections that can cause problems with your ability to absorb and use the vitamin D. So there's another question, is intermittent pain in the throat typical of Hashimoto's, like during a period of inflammation? So throat pain is not typically a symptom in Hashimoto's. That can happen. It's not typical though. So it definitely should be checked out. When people do have an autoimmune disease, any autoimmune disease, they're always more likely they're at higher risk of developing other autoimmune diseases as well. So it could be that it could be going into more of a Graves type of scenario or other kinds of issues. So, so definitely that needs to be checked out to figure out the cause of the pain, or there could be other certainly causes of throat pain as well, or neck pain. So that should be checked out. Other kinds of things is that in something called Sjogren's disease, there can be inflammation of some of the salivary glands that are in the neck. And so sometimes that could be a cause. And I've seen a number of Hashimoto's patients that also have Sjogren's. And so that's a big thing to look at. And one thing that is very common among almost all, not all, but almost all of the autoimmune diseases where people are living with it, is that people tend to have chronic fatigue, or they're just tired all the time, even if they're getting enough sleep or supposedly getting enough sleep. They're sleeping at least 8 hours a night, but they're just constantly tired all the time. That's one thing that very, very often tends to get underdiagnosed in conventional medicine, that someone goes to the doctor and says, you know, I'm just feeling tired all the time. And so a lot of people, you know, when they go to their doctor, most conventional doctors often will just dismiss that and just say, oh, it's, you know, no problem, or you just need to get more sleep, or it's just stress. And the average diagnosis time for most autoimmune diseases is usually, unfortunately, several years before people actually get a diagnosis, because you know, a lot of autoimmune diseases don't tend to be on the radar for most primary care physicians very much. And so someone can feel tired, and then they go from doctor to doctor to doctor until finally they get a diagnosis of an autoimmune disease. So that's another thing, is that if you are, you know, if you're dealing with chronic fatigue and you're getting enough sleep and it's just not explained by other things, then that should definitely be checked out. Because that's one of the first things that I think of is autoimmune disease. I mean, of course, I make sure that people are getting enough sleep, et cetera. You know, but if someone is chronically fatigued, there are a number of things that can be explained by that. And, you know, autoimmune disease is one of those. So that's one of the things that I will do as a standard workup. If someone comes in and says, you know, I'm just tired all the time, I'm checking for a lot of other things too, because there can certainly be deficiencies of B12 or folate. There could be sleep apnea. There could be an iron deficiency or anemia. But it could also be an autoimmune disease. So that's one of the things that I'll always screen for autoimmune disease when people come and say, you know, I'm tired all the time, just because I see so many people that are underdiagnosed. So that's another thing. And if you're dealing with chronic fatigue, definitely schedule, you know, a free personal health strategy session, because we can really kind of delve into that and see what could potentially be going on with you and try to figure out how we can help you. So I just want to remind you again one last time about the Sjogren's and Lupus Foundation of Hawaii. Their conferences are always really informative, and even for myself as a physician, I learn a lot. And they often have things that are giving you information on both Sjogren's and lupus, but also things with tools, how to take care of yourself better, how to manage your stress, how to improve your diet. They often have a lot of other kinds of therapies that are involved, like holistic therapies, that can be very helpful for a number of patients with autoimmune diseases. So again, you know, we're going to put up their flyer on our Facebook page. Their conference is coming up in a few weeks, Saturday, May 4th. So again, check it out. And I thank you for being here. I appreciate the opportunity to let you know a little bit more about the very complicated world of autoimmune diseases, and just a little bit in terms of how I treat Hashimoto's and Graves'. And so again, if you want to talk with me personally, if you have questions beyond this lecture, then you can definitely talk, you know, have an opportunity to talk with me personally. So you can just schedule a free personal health strategy session, and it's easy. Just call our office, 808-425-2987, and you'll also find the contact information on our Facebook page. Mahalo, and we will see you all in 2 weeks. Okay, aloha.